asking in português, so it provided the translator. So, nos últimos dias, alguns dados têm mostrado que há países que não têm só uma curva da doença ou da infecção por coronavírus, mas duas curvas. Uma curva que está se achatando mais rapidamente, que é a dos habitantes mais ricos ou com mais recursos, e outra curva, que é a curva dos mais pobres, que continua crescendo. Eu gostaria de saber se essa é uma preocupação da Organização Mundial de Saúde, se vocês têm registrado esse fenômeno em outros países e se isso pode ter alguma influência nas políticas públicas adotadas nesses países, quando as populações mais vulneráveis têm menos poder de agenciamento, menos voz dentro da formulação das políticas públicas. Obrigada.
Maria may go into the detail, but I think it is as to whether or not we're seeing this phenomenon. But it is very important, and the Director General has said this many times, no one is safe until everyone is safe, and we cannot leave anyone behind. And we have to absolutely ensure that public health surveillance and testing is available to all who need it. And it is very important that testing is not seen as the purview of the wealthy or those who can afford it. This isn't about testing people from a clinical perspective only. This is about testing people so we know where the virus is. And therefore, if people see the purpose of testing in just getting my diagnosis so then I can go and pay for treatment, then that is a distortion of the ultimate purpose of testing. Testing is aimed at doing two things. One is giving people with symptoms an opportunity to be tested so they can get the proper care, but it also triggers a whole series of activities to understand the transmission and dynamics of the virus. So if access to testing is determined by resources, then there's going to be a very skewed understanding of where the virus actually is. And that's very dangerous. That's dangerous from a public health perspective. Not only is it inequitable, it is also dangerous. So it's very important that testing is made available to those who need it. And in fact, in some cases, I believe that testing should be more available in areas where people don't have the opportunity to physical distance, where they may have higher rates of infection and in fact may also have higher rates of death if they are infected. We've seen with many vulnerable populations, we've seen with ethnic minorities, we've seen with indigenous people that they may have higher death rates when they are infected because of underlying conditions, because of long-standing underlying conditions. So it is all the more important that we have early testing of people who may have those underlying conditions. So if anything, testing should be prioritised in areas where there's underprivilege, where there's overcrowding, where there's poverty. But it is, I'm not aware of this emerging systematically in our data, Maria, but certainly if this phenomenon is happening, then this is a very wrong direction, because it is not only inequitable and unjust, it is also a dangerous direction, because you will not know where the virus is and you will not be able to detect those who need care the most.
Maybe to supplement what Mike has said, so the speed in which the virus can transmit relates to the contact between infected people. And so we have seen in a number of urban areas the ability for the virus to spread. We've also seen this in less populated areas. Just because there's an urban area that has a seeding of this virus or the virus being detected doesn't mean that it has to take off. The ability of our ability to suppress transmission relates to detecting people with the virus, so it relates to testing. It relates to the surveillance strategy that is in a country and how countries are actually looking for cases. It relates to the ability to isolate known cases. If those cases who are known are isolated in a healthcare facility and are treated, are provided care, depending on the severity of their symptoms, then they are taken out of the general population and they can't transmit to other people. If contact tracing is happening comprehensively, where contacts of known cases are identified and those contacts are quarantined, then if they develop symptoms, they're already in quarantine. They don't have the ability to infect somebody else. So it's all about the ability of this virus to find another person to infect. And if we stop that, if we break that chain of transmission, that's what we mean. We actually mean breaking the chain of transmission from one person who's infected to passing it on to another one, to pass on to another, to pass on another. If we're able to break that, then we can prevent that from transmitting further. But it is important to know how cases are being detected in a country. It's important to know how, once they are detected, how they are cared for and isolated, and if contact tracing is occurring. But just because a virus is identified in an urban area, it doesn't mean that it has to take off. And we've seen a number of countries that have been able to prevent that from happening, whether it's through the public health measures or it's through these more advanced stay-at-home orders. But it is possible to suppress transmission and to break those chains of transmission.
Thank you very much, Dr. Ryan and Dr. Van Kerkhove. This was a question from Folha de Sao Paulo about inequality, social inequalities and COVID-19. Next question is coming from Savio Rodriguez from Goa